Hello everyone, my name is Dr Gudel. I am a neurologist, chiropractor, reflexologist, vertebrologist and a member of the Association of Manual Therapists, and today I'm going to tell you about Robospine by Mac Brothers, a robotic spine decompression system. The Robospine system is designed for non-surgical treatment of such conditions as osteochondrosis, initial manifestations of scoliosis, intervertebral hernia, protrusion and myotonic syndrome. As you can imagine, all of the above-mentioned diseases cause pain syndrome in different parts of the body, and it's not only in the back. I will talk about this a little later. Back pain leads to impaired mobility of the spine, large joints and generally reduces the quality of life. And it is the Robospine system that can improve your quality of life without surgery. And before I explain how Robospine can help you with this problem, we'll first review the history of spinal pain. The crowning achievement of evolution was Homo sapien, who was one of the first to stand on his feet and shift his center to support. After that, the backbone and the muscles and ligaments that serve it started experiencing problems. Consequently, there was pain. Every kilogram of weight you lift, every clumsy movement you make produces an uneven distribution of the load on the intervertebral discs, which leads to the destruction of the vertebra, intervertebral disc and ligament apparatus along with the muscles that serve this segment. But our spine is not as simple as it seems. Because of its S-shape and complex anatomical structure, it can withstand serious, enormous compression loads. And I would like to highlight the role of the intervertebral disc, which is constantly contracting, relaxing, stretching and taking the biggest load in the entire spinal motor fascian segment and in the column as a whole. Of course, the discs are subject of deterioration and have a limited amount of safety margin. So by maintaining your intervertebral disc during your life, you minimize the risk of the intervertebral disc degrading quickly. The deformation and destruction of the intervertebral disc can be both short-term, like a shock when the patient lifts heavy weight, as well as over a long period of time, when the patient sits in an uncomfortable, forced position for an extended duration of time, such as in a sedentary job. And whether it was short-term or long-term impact, it all leads to pain. And unfortunately, in 99% of cases, the patient begins to fight not with the cause of the pain, but with its consequence. When a patient is in pain for a long period of time, he or she begins to look for the cause. This person makes an appointment for an MRI, gets a diagnosis of hernia, and then goes to a neurologist with this diagnosis. The neurologist sees that there is a hernial protrusion and prescribes a consultation with a surgeon. What can a surgeon suggest? Only surgery. With the Robospine, you can solve your spine problem without surgery. It will relieve you of pain by eliminating the cause, specifically the deformation of the intervertebral discs. How does it work? As you're already aware, the spine is constantly experiencing compression, the compression of the intervertebral discs. And Robospine is aimed to decompress, that is, stretching of the intervertebral disc. Robospine uses a natural, organic way to stretch the spine. As you have seen, many animals stretch their back warming up, before jump or after sleeping. Any athlete hangs on the chinning bar after a heavy load in order to ensure that the spine stretches on its own under its own weight. And as you may realize, spinal traction most likely appears with the spine development. The first mention of spinal traction dates back to the 3rd or 4th century BC, the so-called Hippocratic bench, where the spine traction was intended to increase the patient's height. There were also some manual techniques that stretched the patient, his spine, muscles and ligaments by hand. Then it all started to become a more device-based method. And at the end of the 20th century, there were dedicated devices for stretching the spine, which not only stretched the spine in 2 dimensions, but could already give the angle at which traction was more effective. Robospine incorporates all the innovative solutions in spinal traction and makes it possible to safely perform the procedure for the patient and his spine as a whole. What is groundbreaking about this system is the mechanism of applied force on the spine, particularly the system of automatic dosage of the force developed by the apparatus. The system recognizes the level of resistance of the spine in continuous automatic mode and constantly changes the stretching force. As you know, the spinal compression occurs in different vectors and positions. So Robospine performs spinal decompression by determining new or different spinal extension angles. The force is applied in different spatial planes, or as they currently say, in 3D. That's why, when talking about Robospine, we are talking about multiplanar decompression of the spine. The specificity of Robospine is that it preserves the physiological position of the vertebrae relative to each other during decompression. Robospine has both automatic and manual modes of operation. This allows the doctor to choose the individual direction and force for each patient individually. At the same time, the automatic protection system is always on and prevents the patient from being harmed during the procedure. Thus, the system has a high level of error protection and focuses on a comfortably and safe procedure for the patient. The security system consists of a set of hardware and software blocks, and that is why the security system is protected from hypothetical failures in its software. If the patient is afraid, experiences pain or any uncontrollable condition, the patient can always press the emergency button and the procedure will stop immediately. Such a high level of safety is very important when it comes to treatment, traction and decompression of cervical spine. And with Robospine, you can perform the procedure with absolutely no fear that something might go wrong. Decompression of the cervical spine on the Robospine is a whole different thing, because it has 8 positions where we can either manually or programmatically provide flexibility and extension of the spine, allowing for a comfortable procedure on this equipment. The thoracic section of the system allows for rotational movement around the vertical axis of the spine. In addition to stretching, the lumbar spine can also perform pelvic pivoting movements relative to the axis, and it is equipped with an element of soft impact on the sacrum. Another very important feature that differentiates Robospine from other systems is that during the procedure, the patient's head is always higher than the legs. This prevents excessive blood rush to the head and makes the procedure more comfortable. The system does not use patient's own weight, because all patients have different weight, and this eliminates the accuracy of the dosage of forces applied to the spine. In general, the procedure is very physiological and comfortable for the person. If a doctor decides to perform the procedure in manual control mode, there are joystick controls on the bed. They allow you to operate the system manually, being in direct contact with the patient. They are freely positioned and can be placed anywhere for the convenience of the treatment and the doctor. To control the system, there is a freely movable remote control which provides user-friendly interface with the system. It has direct access to the system control and is equipped with a color display. There is also a voice notification to the patient about the start and end of the procedure. Moreover, for the comfort of the patient, there is an LCD monitor at eye level, where you can watch any video or audio content. And of course, the design of the system. This is absolutely outside the scope of medical equipment design. Well, really, it looks like a spaceship from the future. Equipped with 4 wheels, the system is very mobile and can easily be moved around any medical facility. It fits easily through the standard doorways. All you need for this high-tech system is a small space and a standard 10-amp electric outlet. Robospine, I dare say, is a breakthrough in medical equipment that allows you to treat a herniated disc without surgery through decompression. Thanks for watching. Take care and be healthy. One more thing, if you want something you've never had, you must be willing to do something you've never done.